Hi, this is Karen Harrison. Welcome to June 21 Reiki Call. I am delighted that you're here. My website is karenharrison.net, and I have a wonderful guest with me tonight, Tracey Sullivan, a good friend of mine, another colleague of mine in the International Center for Reiki Training. She's one of our licensed teachers. And I had the honor of mentoring her through the licensed teacher training program. So that was so much fun that I got to spend time with Tracey and even go to Connecticut and co-teach with her. And Tracey has a pretty amazing background. She teaches all the levels of Reiki through the ICRT, and she's also taken Animal Reiki Master, certified in holographic sound healing, Jikiden Reiki, Reiki sound healing, a medical Reiki Master with Raven Keys. And Tracey is a nuclear medicine technologist, which I think sounds very impressive. I have no idea what that means or what you do. I never quite figured that out, but it is very impressive. And Tracey has been teaching Reiki to staff members, patients, and family members and volunteers at Yale New Haven Hospital since 2014. And has taught staff members at the Veterans Administration Hospital in West Haven, Connecticut, provided many educational talks on Reiki. So lots of experience. So welcome, Tracey.
Thank you, Karen. Thanks so much for having me.
Yes, I'm happy to have you here. And we'll have some time for questions and answers a little bit later. If you're not talking, I would just invite you to mute yourself just so that we don't end up with any funny background noises. And if you don't know how to do that, I can mute for you. And on the phone, you can mute yourself with *6. Is that right? Is that right, Tracey?
I believe it's *6, Karen. You're right.
Okay. All right. And I guess I'm not able to mute Joan. I tried, but that didn't work. Okay. All right. Well, I just want to see what you can tell us. You know, you can talk with us about hospital Reiki and Reiki in the medical field. Yeah. Oh, and working in healthcare since COVID. What has that been like?
Oh, yeah. So that's been really interesting. So I feel like I have used Reiki in my practice as a nuclear medicine technologist more in the past year and in different ways, more unique ways than I have ever. Even though I've been teaching Reiki in a hospital for quite a few years now. We've actually I've taught 17 classes, Reiki 1 classes at Yale New Haven Hospital so far. So, but the past year has brought, as you all know, a lot of different things that we've had to deal with as far as just being a human being in general. But when you put it in the perspective of somebody that works in the hospital setting and somebody that travels from hospital to hospital, as I do, Reiki has helped me so much in the sense that there's not only COVID now, but there's also politics and people's beliefs about just what's going on in general, that it comes into play in the medical practice as well. So it might not be something that you would think about necessarily, but wherever you go, people have a different belief system. So, and when you're in I'm a nuclear medicine technologist, so I go into hospitals and I'm training people on how to operate a PET CT scanner, which is like a CAT scanner, a CT scanner. It's a piece of medical equipment. And I'm going in there and I'm training them how to use it, and I'm training them on the software. So my job is that they are the customer, and it's a corporate job. So you have to, the customer is always right, right? So you're there to provide them training and information about the system. Well, what's been happening over the past year is people are very vocal about their belief system on, what's been going on with COVID and in politics, and just about anything that has been going on over the past year. They feel very free to talk about it. So the reason I bring that up is because it is how the way that I've dealt with that is to bring Reiki into that.
Good
So
idea.
yeah. So what started happening is I was starting to get like really stressed out going into these places, because not only do we have COVID to worry about, but I have a lot of people that they speak their minds, and I don't necessarily agree with what they're saying, but I have to stay there in, the situation. So I started to think about, how would Reiki respond to this? And, how do I use Reiki in a hospital setting when I'm going there to with the intention of going there to give somebody Reiki or to teach a class? So I started to kind of become Reiki when I would walk into the hospital. And what I noticed just by setting that intention of becoming Reiki is that I would come from the words that I would choose to say, and the way that I would respond to the people that were speaking to me would be with words that were starting to seem like words that they needed to hear to help them to start to heal whatever it is within them. And I'm talking about staff members. I'm not even talking about the patients.
Mm.
So staff members that I was dealing with regarding these all these different situations with what was going on in the past year. So it was really interesting. I would stop at first. I had to like really stop myself and make the intention to do this. When somebody would say something and I would feel myself reacting inside, I started to talk to myself, in my head, and just calm myself down, and then just let Reiki flow through me and to them to help to heal whatever was going on at this moment that is the reason why that they're saying what they're saying, or acting the way they're acting. And I have to tell you that that simple act of doing that, that conscious act of doing that, impacted the whole room, it's probably like most of the control rooms where I work probably have anywhere from like 2 to 10 people within them. And I should tell you that the people in this career are usually very like type A personality and very competitive, and very, they don't like to be wrong. They like to be the one that knows everything. So there's a reason why people are like that, and it's some. I focus on the heart when I encounter people like that in my Reiki practice. So I started doing it in my nuclear medicine application specialist practice, and it started to like really impact my environment and the interactions of not only me with these people, but with the people amongst themselves. it was changing, and I started noticing harmony among the staff, and the training would go better, the interactions with the patients would go better. It was really, I could just go on and on about it, Karen, but it really quite amazing. So that was like an unexpected um, you know, uh, occurrence with or outcome of my Reiki practice as it has to do with the medical field. So just being Reiki. Now I tell people when they ask me, how can I bring Reiki into a hospital?
Oh, well, just a second. May I just say something real quick?
Yes, of course. Yeah.
Well, I just wanted to say thank you for that sharing. I think that's useful to all of us in our personal lives, because
Hmm.
I'm sure that we all know people with whom we have different opinions on any number of subjects, not only COVID, but or vaccinations, but on lots of different subjects. And what
Absolutely.
you're really talking about is activating Reiki, being Reiki, and intending to send Reiki into that discussion and to the person. And it sounds like you're truly listening. And, from that standpoint, that's always going to create the best result.
Absolutely.
So I just
Uh,
wanted to highlight that before you moved on. Yeah, the talk about, offering Reiki in a hospital. And I know you've taught a number of classes, and I assume you have
mhm.
to change Reiki somewhat to teach it in a hospital than if you teach it regularly.
Yeah, well, if you're teaching in a hospital, there's certain guidelines that you would want to go by. Of course, it's going to vary from hospital to hospital, or medical setting to medical setting. But I think in general, these will apply to any practice. So since you're going into a hospital or whatever organization it is, there's probably going to be things that you're not going to do that you might be doing in your regular Reiki practice, and this applies even if you are give. There's a car beeping right out here. Sorry about that. If you can hear that. Um,
Done
I'm
here.
in my hotel room. I'm traveling. But anyways, so this would apply to you even if you were not just a Reiki volunteer, but if you were giving Reiki in a medical setting as well. So there's certain things that you probably wouldn't do, and those are things like Biosyn scanning, where you're moving your body, where there's a lot of body movement, or if you some people when they're drawing their symbols, they'll move their hand in a clockwise or counterclockwise direction. So things like that, and drawing symbols, you wouldn't want to do that either. So the more streamlined and just going in there and giving Reiki, intending for Reiki to flow. When I'm in my personal practice, I'm always I put my hands in gasho, and I often will do Reiki Ho, put my hands up to my third eye and wait for that indication of spirit of where this person needs Reiki. So you're using your intuition, right? Um, those are things that you wouldn't probably in most settings wouldn't do in a hospital. And that's because people don't wouldn't know what you were doing. And and probably the organizer of the Reiki practice is going to advise you not to do any of those, Biosyn scanning or drawing symbols, and also the words that you use. Many facilities the facilities that I've been to, they have a script that they give to the Reiki practitioners. It's written out. You get your this if you were teaching in a hospital, you would want to teach this as well to your volunteers. So you would come up with a script of what they would say to the patients. Um, So this comes in really handy with a lot of people. At first it sounds like, oh, I don't know if I would like that. It's, so scripted. Well, a lot of people have a hard time when asked, what is Reiki, to give a very concise, easy to understand explanation of what that is. It just kind of stumps people, I've noticed. So having a script is something that is a really great thing to do if for your Reiki practitioners to teach that, or if you're a Reiki practitioner going into a hospital, don't be surprised if you are given a script. Um, so another thing that is going to be different in a hospital setting, teaching or giving Reiki in a hospital setting, is that you're going to have to abide by something called HIPAA. And by now, most people know what HIPAA is. It protects a patient's privacy as far as their medical patient health information goes. It was activated. It's a law. It's a federal law that was put into law in 1996. So it's the Health Insurance Portability and Accountability Act. And that is something that we don't necessarily use in our private practice. But when you go into a hospital, and typically hospitals are going to have you go to a class on HIPAA before you'll be able to do any volunteer training, or definitely before you're teaching volunteers or staff in a hospital. Another thing that's going to be different in a class in a hospital is the safety things. Of course, we're always conscious of our clients' safety in our private practice, but in a hospital, you have people in beds, and there's rules as far as the bed. You cannot leave the room unless you've brought that bed down. And even talking about beds, being in a hospital and giving Reiki to somebody in a bed is a whole different story from having somebody on your nice massage table or your Reiki table where you have all this room around you. In a hospital, it's a different story. So um, if you're teaching a Reiki class to people that are going to be working in a hospital, what I do is instead of having Reiki tables, I'll have stretchers. We borrow stretchers from the hospital so we can bring the stretchers up and bring them down, and they have the side rails. So that's a big safety concern as well, is making sure your bed is locked and your side rails are up when you leave. And I've heard people say that they don't really want to put the table down because of the patient. They've been giving them Reiki, and they fell asleep and they don't want to bother them. Well, it would be a really big deal if you did not put the table down and somebody walked in, one of the staff members or somebody walked in and saw that table was up. It would be a safety violation. And then, you would want to know, like, what rooms not to go into. So if a person is so you need to know what to look
Oh,
for on the
can I just,
door. And
can I just ask
what
a
was that?
question?
Sure.
So you don't give people Reiki in their own hospital bed. You have them get out and get on a stretcher.
No, that's just in the when I'm teaching a class, to give
Oh,
the volunteers, the people that are going to be performing Reiki in the hospital,
mhm,
um, give them an idea of what it's going to be like. When
mhm.
giving Reiki in a hospital, you have to adjust to that bed because not
Yeah.
every patient is able to get out of that bed.
Yeah, and you have to make sure you
Right.
don't like knock the IV out. That'd be really bad.
Yeah, that would be really bad. That would not be good. They might not ask you back again. You wouldn't do that, though. Often when you're giving Reiki to somebody in a hospital bed, you're not doing all the hand positions. So you have to get like the normal stuff that we learn in like Reiki 1 and Reiki 2 class. You have to like just release that from your mind, because it's not going to be like that. It's going to be, you go in there and you might only be able to give Reiki to their abdomen, and that's okay, right? We know that Reiki will go to where it needs to go for that patient. Sometimes the patients are up in a cardiac chair, or what, you know, one of those large lounge chairs. So with those, you can stand behind it and put your hands on their shoulders, and then their knees. So you use you have to use your common sense, right? When you go in and you see the situation with the patient. Before you go in a room, you want to make sure by checking out and this is all stuff that we teach in the class, and that you would learn if you were going to volunteer somewhere. You would want to check in first at the nurse's station to see which patients are requesting Reiki, right? So there's a whole system in place. And if you are the one that's bringing it into the hospital, you would be the one that is putting this system in place. You need to have a system in place where the patients know Reiki is available and they can request Reiki. And then there's a place for your volunteers to look to see who wants Reiki. So that's real important. You're not just going into any room. You know, and then, you know, hygiene, of course. And we're all like top notch. We're like really big on this nowadays, right? So we all know what really good hygiene is.
Yeah,
So
we
you're,
learned to wash our hands this year.
yeah.
Yeah, I mean, who knew we were supposed to,
Yes.
you know,
Yes,
do
that's
the
right.
thumbs and fingers and the backs of the hands and
Mm-hmm. And there's a time period, you know, you're washing your hands for at least 10 seconds. And, you know, there's a whole proper way if you're wearing gloves, which you would be wearing gloves. There's a whole way that you would learn to take them off and put them on. And if you wash your hands before, and then you take them off outside the room, in the ante room if they have one, or in the basket right before you leave the room, and then wash your hands again. So and that's stuff that you would learn, you know, in the Reiki class briefly, but before you started working in the hospital, you would have to go through training on that stuff too. So you know, the biggest thing I think for me, as far as teaching in a hospital, was that you really have to give up control. You have to give up the control of your, you know, it's not your class anymore. You're doing this for the hospital. So that was a little hard for me. I didn't think I was a very like controlling person, but I really liked like having my class, you know, the way I liked it. I'm very flexible within the class, but I like to have things a certain way. In this class, I really had to give up control to the Reiki coordinator, and she told me what she wanted me to teach. I could teach what she wanted me to teach any way I could present it in any way that felt right for me. But if you have a Reiki coordinator that you can work really well with, that is an ideal situation. And Fernanda Clariana, who is the Reiki coordinator at Yale New Haven Hospital, is phenomenal, and we worked really well together. Um, so those are the main things, Karen, that would be different um, as far as teaching a class in a hospital versus teaching, you know, a private class.
yeah. Well, that's good. Well, I want to just check in with the participants and see if any of you have any questions so far. Yeah, Stacy, do you know how to unmute yourself?
Yeah,
There
I
you go.
just did. So I have a question for you. I'm an RN, and I've been practicing Reiki in the hospitals my whole life for the last 44 years or 31
Awesome.
years. But, you know, I always ask permission from the patients. I've never brought
Yeah.
it to any nurse's attention, and my last job was in a prison system, and you're not allowed to touch the patients. So I would spend my time beaming or, you know, in the area. But my question is this, who decides? So did you have a Reiki coordinator because you are not a nurse, because you're a technician? Or, I mean, is that something I would look to ask for, a liaison, a Reiki liaison in the hospital to work with me based on their stuff to learn what they want? I mean, how would I approach that? What's your advice?
So in the hospital I worked, so here's a bit of information that will clarify this for you. I worked as a nuclear medicine technologist in at Yale New Haven Hospital. So quickly, I'll just give you like the how it came to teach Reiki at Yale. So
Yeah.
I they created a new cancer center at Yale, and they asked for people to support the cancer center, like financially make donations. So what I did was I started a race, Hope is Coming 5K, and I was donating the money to that from that race to the hospital as my donation to Smilo, the cancer hospital. So I met Fernanda, the Reiki coordinator, through that. And I met her at an event, and I asked her if she wanted me to help at the next event she was having. So that's how we became friends. And after then I started volunteering Reiki in the hospital. Then I started donating all the money from the race to the Reiki program. So it created a fund for the Reiki program that created the teaching is within that fund. So because Fernando was the coordinator at Yale New Haven Hospital, not all hospitals have a coordinator. But Stacy, it was really helpful to me. And if you are thinking about, if you would like to spread that through your coworkers, and if you're thinking about at your hospital, to have a point of contact like that is really valuable. So I guess do you teach at a large, or do you work at a large hospital, Stacy?
I just retired from nursing after 44 years, and I was working in the prison system for the last 4 years. I'm a dialysis nurse. And
Oh, okay. So they
psychiatric nurse.
probably don't, they probably don't.
So,
know.
so no, at the prison, no. But so how did this woman become the coordinator for Reiki? Is she a Reiki teacher herself, or so she was
Interesting.
already in place when you came along?
She was in place when I came along. Um, she was an interpreter. She started off as an interpreter. She's from well, she speaks Spanish. It's her first language. So she was doing interpreting for at Yale, and then she became a coordinator with the music program. And somebody else was doing Reiki, kind of like what you described, Stacy. And they wanted to bring it more fully into the hospital. And this woman left that had been doing it. So they asked Fernanda if she was interested in doing it. They put it under her as the coordinator. So that's what made her take a Reiki class. She decided she would take a Reiki class since she was going to be the Reiki coordinator.
Very
So
good.
if you're interested in something like that, I would really highly recommend reaching out to either, I don't know if the prison system would go for that, but you know what? I've always thought that they need it so much there. Have you thought about reaching out to them with a real
I talked to
presentation?
Michael and out at Sedona. Michael and his wife did a federal prison program. But right now I'd like to stay local and just see how I can get my foot in the door to a hospital. I know the warden well at the prison. I'm not really sure. I'd also like to work with the state police. Some of my clients are state police, and I'd like to get my foot in the door there. So I'm interested in hearing how people got their foot in the door and how things got started.
Well,
but-
it's always, in my experience, it's been you're doing something else and the universe just kind of puts you there. It's funny. So I was volunteering and doing Reiki, and they asked me to teach a class. I did it as a volunteer. They were going to start paying me after I've been doing this. I've been doing this for a couple years. And
Okay.
it just, if you just simply by volunteering to do this and to put yourself in the position and make yourself available is sometimes really all you need to do. What I do for you, Stacy, is get you in touch with Fernanda. What state are you in?
I'm in Florida. I'm from Connecticut, Wilton, Connecticut, actually.
Oh, wow.
Yeah.
Oh, how
I would
funny.
love to talk with her. I would love to get in touch with her.
Yeah.
Tracy, so I have your website, Karen. So after the meeting, then I will connect with you there.
Sure.
Okay?
Yes, I
Absolutely.
forgot to mention her website, reikiintegration.com. Correct?
I love that too.
Yes.
Thank you.
Okay. And I think Karen had a question.
Yeah, I do have a question. I'm an RN too, and I've been doing oncology for the last 16 years. For the last 5, I actually work from home and do like nurse liaison education kind of thing. But I would like to, like Stacy, I would like to bring it into the hospital somehow. So I got a lot of good information when you were talking to her, but I guess one of the questions is, when you provide Reiki for the nurses over there, is there any CEUs or anything like that that you can give? I know at one point in time, Karen gave CEUs for that, but I don't know if that's a thing anymore.
Yes. So I've done multiple presentations, and for both of you, this is another way of bringing Reiki into the hospital. I've done multiple presentations, like 1-hour presentations, and I do them according to the audience that I'm giving the presentation to. So Stacy, you could do it on dialysis, that's your specialty, and how, integrate Reiki with dialysis, like you've been in your practice, it sounds like. So you would choose a specific subject, and if it's that you want to bring it to the staff members at any particular facility, then you would focus on staff members and how Reiki fits into a hospital and how it helps the employees to, and it does help them in many ways. And so with anxiety and the ways that Reiki helps us in everyday life outside of the hospital, it helps staff members, nurses, wherever, it doesn't even have to be in a hospital, it helps morale. Oh, I'm sorry. Was somebody saying something?
No, go ahead.
So, you would want to first seek out whoever it is that, if there is a Reiki program already in a hospital, seek out the person that is the coordinator of it, or the person that's running it. If there's a complementary medicine department in the hospital, seek that person out. And what I highly recommend is to go prepared with what you want to bring. Like, what is your mission? It's almost like a business, if you're writing up a business goals and your mission, and what you want to bring to this and what the benefits are going to be for staff members, for patients, and for the administration, actually, because it helps the administration as well, in the fact that patients are requiring less medication. And these are factual things that there were clinical studies done that showed that patients who received Reiki were requiring less medication. They were being discharged from the hospital sooner. They were happier. They had a better sense of well-being. So that's saving the hospital money. So it was that fact there that really made the big difference at Yale. And people started to really hear about what Reiki is because they saw how it affects the bottom line. And, the bottom line is they say is patient care, but we know that the bottom line has to be finances, because that's how everything runs. So did I answer your question, Karen?
Well, is there, for the nurses as a bonus, is there continuing education credits for them?
Yes. So that's what I was starting to tell you, is that I created, I probably have like 4 or 5 presentations that are worth a CEU. So it was an hour presentation, and it was approved for CEU, and the class that I taught there was approved for CEUs as well. And there's different ways you can go about doing that. You can do it yourself, or you can go through, there's usually, you're a nurse, so I don't know if you're familiar with like the person where you work or where you worked that is in charge of CEUs, right? The person, there's a nurse that is handling the CEUs for the system, the hospital system. But you can get these approved on your own.
Through the board?
What was that?
Through the nursing board? Like for nursing credits?
Yeah. Yes. Yeah. I received everybody. I've done presentations at Yale to diagnostic radiology and nursing, and in the class that I taught there, all the nurses that take the class there receive CEUs through their nursing board, and I think it's different for every state.
Yeah.
Well, Tracey, what I'm wondering about, I don't know if you have done this or thought about doing it, is offering a class in how to do Reiki in a hospital online for people across the nation. And then you could create your own CE form with the name of your business that people could turn in for potential credit on, what you need to know about giving Reiki in hospitals.
Yeah, I've thought about that. I would love to do something like that and help people with the PowerPoints, and just to come up with ideas of, what are you interested in, and focus on, what your passion is in healthcare, and, let that guide you and create from there. I think that creating PowerPoints especially in the healthcare setting, is almost, you almost can't get around it if you want to receive credits, if you want to have a presentation where it's going to receive CEU, because you need to, as you probably know, you need to submit your material, an outline of it and your credentials before it's going to get submitted. Sure. It's easy if you find that person who takes care of that, who does that.
Well, Tracey, I was thinking that, you could do that, based on the classes that you've taught at Yale, you could offer a similar sort of thing online. And of course, each hospital or medical setting would probably have to maybe tailor it a little bit for their unique situation and business. but I would think that
Yeah.
probably at least 90% or 95% of it would be applicable to any sort of medical setting.
Yeah, and every state is going to be different. Like in Connecticut, they don't even need CEUs. Um, they're not required to have a certain number of CEUs, where some states they are.
Yep.
In my job, we are required to have CEUs. So I've done the process for a couple different modalities. So it's basically the same for all of them. As long as you're concise. But yeah, I would be happy to do something like that.
I would be interested in sitting down and taking a program like that from you, simply because right now I have a gazillion questions and I don't want to jeopardize with all my stuff. But you know, as you were talking about this woman,
Fernanda.
Fernanda, my mother had open heart surgery at a small hospital in New Hampshire going back 16 years ago. And the moment we walked in the door, they handed us a brochure on Reiki. Everybody from the cleaning people to the director of nursing did Reiki. My mother left ICU, CCU, and they immediately brought me in and reeled up the bed and was like, and was helping me find positions. It was extraordinary. My mother left that hospital, major open heart surgery, 7 days.
Wow. So,
Which is
yeah, see, that's
unheard of.
a beautiful example. I'm so happy that your mom had that experience.
Oh, it was incredible. Well, my mom
That
was a
is,
Reiki too. My mom was Reiki too. I was a Reiki master at the time. So, because my
wow.
mom was, you know, I'm Reiki too. I know what it is. I can help. So my mom was going around helping people after her
Oh,
surgery.
wow. That's
Reiki.
awesome.
It was incredible, incredible. So you only teach Reiki 1 to whatever group is going to be doing the Reiki in the hospitals then. Do I understand that you don't do Reiki 2 with them?
I'm
Is there no
starting
need?
to, I have started to teach Reiki too. I haven't included that because it's new and I've only taught a couple and it's been online. I've taught Reiki too because it's been since COVID. So they're not letting volunteers yet into the hospital. So it's kind of, we're still getting into that phase of starting to let people in, but yeah, it has moved into Reiki too as well. So it's pretty incredible. And like I said, I was happy to do this as a volunteer because I just love volunteering. There's something about volunteering that just really it's such a beautiful thing. But you know what? And I don't know. I think it's just the universe. The things are going to happen the way they're meant to be. They decided that I should be paid. So, you know, of course I accepted.
Why not? Yes. You know?
Yeah. Yes. So my thing now is I am going to start volunteering at a hospice. That's the next thing that I'm being drawn to do.
Okay.
Yeah,
So,
so tell us a little bit about that. I mean, is it different to establish Reiki in a hospice than a hospital?
well, I haven't done it yet. So you have to be a Reiki master well, in the hospice in Connecticut, I don't know. And that's another thing regarding Reiki in a hospital is that some hospitals, some medical settings will require a person to be a Reiki master. And others, like Yale, you can be Reiki 1 and be a Reiki volunteer there. So the hospice in Connecticut, and there's only one, does require you to be a Reiki master. And I feel like I've done a lot of well, I've done a lot of work with people that were dying because I was actually an LPN for many years before I became a nuclear medicine technologist. So I worked in a step down unit and I just happened to be there, as you nurses know. You know, I worked in a step down unit in a VA hospital. There's a lot of, you know, people passing away. So I have a lot of experience with people dying. And I just really always felt drawn to that. And that whole process of leaving the body and the transition. I just feel it's an important part of our cycle that really needs to be honored, maybe more than it is sometimes. So I don't know like what is going to be different besides the fact that you have to be a Reiki master in the state of
So anybody working in that environment, they're insisting must be at a Reiki master level.
Correct.
So you can't bring in a group of volunteers then, huh? Huh, okay.
You can't.
So I have another question for you. The VA hospital, Veterans Hospital, when you were doing the Reiki in there, have you seen William? Have you seen, okay, because this is sort of a hot button for me. I'd love to get into a veterans hospital, but there's a book written by William Gary, and it's about how the post-traumatic stress, he does not believe, this is, I'm taking it out of context, but he does not believe the post-traumatic stress is related to the trauma of the environment as we've always connected it, that he believes that there are spirit attachments, and that the only way to get rid of the post-traumatic stress is to release the spirit attachments. He's written a book called Healing Lost Souls, Releasing Unwanted Spirits from your energy body. And he's also written a book on technique. But I would love to do some work with the veterans on that. I have police officers now who are just having Corona Reiki and Holy Fire, and they're saying their PTS is just like rolling off of them. So I'm very excited about that, and I would love to do more veterans. So this is where I'm wondered if you found they had less PTS when you worked with them.
So I think I would, I think so. I can't say for sure, but they appear to be able to relax tremendously. It's
Okay.
track in my community, my veteran community, it's hard to track them over time because they come and go. Do you know what I
Okay.
mean? They come
Yes.
and go, and but they're receptive to it. And you, as you know, you don't have to touch them. What I tend to do with the veterans, and I would love to, I haven't heard of that man that you were speaking of. I'll have to look into that. But what I do with them is I focus on something that they makes them happy, or an experience that they remember that was a joyful experience. And I have that be the thing that they have in their mind, the focus in their mind as I'm giving them Reiki, and I'm setting the intention for that to grow within them, for that peace or joy to grow within them, and take up the space of anything that isn't that. So I have found that like really simple, you know, very, you know, I don't interact with them or talk too much or touch them at all. I have found that like really seems to work really well. And so I started doing it on just all of my clients, is to have them think of something like joyful, or just even if it's just something that is just peace. You know, I get them to a place of at least not having anxiety, and amplify that. My intention is to, like, that's like a pre-amplifier, and then within the session to amplify that effect and grow it. And with the veterans, I've found that has worked really well from what I can see, Stacy. The
Okay.
problem is there's no tracking where I am.
Yeah.
So it's kind of hard to tell. The people that come to me that are veterans, though, that outside of the hospital, the people that come to me that I know that are veterans, um, the Reiki does help them tremendously with
Yeah.
PTSD and with any physical injury that they've had. And I have done healing spirit attachments with them. If they, I offer it to them, if they're open to it, then I do it. And that works really well. So I'm guessing I can imagine that whatever that process is that you just explained to us, I'm sure that works like wonderfully because I know,
I haven't read his book yet, but I will send that to you as
yeah,
well.
please
I'll
do.
write down the name of the book. And he has the technique is the second textbook that has come out recently. A girlfriend of mine is into that in Washington State. And um, so,
Hmm.
so
That's
I'll pass it on to you.
Yeah, I'm a veteran myself, so I have like a real like soft spot in my heart for and I worked at the VA. So
Well, I continue to learn more about you, Tracy. You have many talents. You know, one thing I'm thinking about, do you offer coaching for people who have more questions and, just want to have more time with you? Do you offer that?
well, what I am starting, I don't know if this really is what you just described, but I'm starting a monthly, well, it's a 9 month, once a month, like a mentorship program where, because I had so many students that were asking me about specific topics, so I'm covering them in over a 9 month period. And I'm starting from practical things. And one of the practical things would be the CEUs, how to do that, how to create a PowerPoint, because a lot of people don't know how to do that. They're just kind of lost when it comes to computer stuff. But they really want to teach and they really want to be able to implement this in their lives and into the lives of, other people. So I'm doing something like that. I don't know if that would be
Well,
it's not something where you'd have to be there every month.
Yeah.
I just kind of I'm going to send out, and I haven't started it yet. I'm starting it in the fall. I'm planning on sending out like the agenda for each month. So if you were interested, you could do
yeah.
that.
Well, that's cool. And I was
Yeah.
thinking, that if people have more questions that they want to ask you about how to get Reiki into a hospital or want some, private coaching, um,
Hmm.
is that something that you would be interested in doing?
Yeah, sure. Yeah, absolutely.
Yeah, because we're gonna need to move into wrap up here. And, if you
Oh,
have more
yeah.
questions or, people that watch this program, later have more questions and want to book time with you, then they can contact you through your website and, you know,
Yeah, sure.
book,
Absolutely.
book some coaching time for Reiki in hospitals and medical settings.
Yeah, I'm all for that. My goal is for Reiki to be in every hospital, you know, um, in every clinic, any place. If you think about what you're finding in the hospital, when somebody has a physical illness, it's because things from, the mental, spiritual, emotional levels, something was not dealt with. The physical is the last place something shows up, right? So you have a whole population of people in hospitals that have gone through this. When you look at it like that, when I think about it like that, it's almost overwhelming. I have this like such drive to bring Reiki, because I know there's other things as well, but that's our thing, right? Just to bring it, because I know that it can help. And people are at that stage, that end stage where it has become physical, where they really need to be need help. So yeah.
Well, I'm just so grateful to have you take this time to talk with us. And your website is reikiintegration.com. And yes, we look forward to learning and hearing more. And I'm just going to hold that vision that you're going to develop a class for people on how to do Reiki in hospitals online that people can take. I think that'd be very cool.
I would love that.
Yeah, that's
Yeah.
awesome. Just contact me. Absolutely. And I would love to help anybody that is looking for help with this.
Okay.
Okay.
Thank you.
All right. Well,
Yeah.
thank you so much. And thank you all for being here. And I appreciate you all. And I'm Karen Harrison at www.karenharrison.net. And this monthly Reiki call, we have it the third Monday of the month. And if there's topics that you would like to hear about, let me know. We'd like to talk about what you're interested in. So thank you all very much, and big hugs to everybody.
Thank you, Karen.
Thank you.
Thanks.
Thank
Thank
you.
you, everybody. Thanks for
Bye.
your attention and your questions.
Tracy and Karen.